Hi, I'm Eric Coulter. I'm the instructor this fall for H650 Public Health, Finance, and Budgeting. And my background is pretty broad and pretty extensive in the area of public health and of course into the financing, budgeting area. So I wanted to take a moment to kind of go through kind of a glimpse of what I do from a public health background and on a daily basis, so you'll get to know me a little better. I spent nearly a decade working primarily in the clinical area. I was a clinical social worker. I worked both in the mental health field and then also for a hospital, and then some in the military and the National Guard as a medical services officer. During that time, I decided that I wanted to get into the management portion of it, and I went back to school, started working towards an MBA, and then later transitioned into my doctorate. After completing my graduate school, my doctorate in 2001, I began teaching in the IU system. I've taught a slew of courses, primarily in the business economics area, both online and typically do that more now, and then in the classroom. So I've really done both. But this fall, the opportunity to teach in the area of financing and budget, I thought was a good opportunity for me, and I thought I would have some things I could share with you and help you in your professional careers. I'm very excited about the opportunity to teach this class and help you as students be exposed to the use of numbers in your daily life. You may not be doing that professionally currently, but really it's something you can't escape from. I never thought I'd work with budgets and numbers, didn't care for it much early in my career, but as money has become more and more scarce, particularly in the public sector, you have to have a background in knowledge, at least a good understanding of finances. As the executive director of the Wayne County Health Department, we have two main areas that we focus on. We do all the traditional public health things you might think of, and many of you may work in these fields. We go anywhere from birth certificates, death records, restaurant inspections, sewage inspections, housing inspections, and then of course some of the traditional public health nursing areas such as childhood immunizations and adult immunizations. So we do all those things. But another area where probably the majority of our staff is involved is our community health center. We are a state-funded public health community health center. We are also a rural health qualified health center, which we receive extra money for that. We have 2 full-time physicians and 2 full-time mid-levels, nurse practitioner and a physician assistant, and we've had a client base of patients as high as 11,000 medical patients. We primarily, we do third-party billing, primarily Medicaid, Medicare, but we do take other insurances and self-pay, and have been doing this for the past 25 years. One of the things then our community health center we've begun doing in the last couple of years is we became a rural health certified community health center, which brings in enhanced revenue, but also creates additional problems in terms of the cost accounting and some of the things we have to do with that. We're in the process of considering federally qualified health center status, which will bring in additional revenue, but also grants. But one of the things I thought would be very important to you is that we receive funding on a local level, primarily tax supported, on a state level, primarily grants, and then on a federal level, which has been grants and enhanced revenue that we receive for being rural health certified. We are currently in the process of working on another federal qualified certification level that will take us into another level of additional pay, but these things are complex. You have to deal with things on a local level with our elected officials, and then you have to be able to deal with the state component and then the federal and take all that and be able to mesh it into one. And sometimes it's very confusing to the parties you have to work with. Each area they think takes precedent or priority over another area. So it's a balancing act, but I think it's important, and I hope to share some of that knowledge with you as we proceed through this class. To conclude this overview, I never thought I would be working with numbers. It's not something I generally liked. I started out majoring in social work, went back, of course, and worked on this through my MBA. But what I'd like to say to you, you can't be immune as a manager in today's work environment, public environment, not understanding dollars. You have to have the ability to understand them and how to be able to get them. Things are scarce. I think in the future it's going to become more and more scarce in terms of the financial resources as we see more and more cutbacks in the tax rate and some of the other areas. So you have to be creative and skilled at finding these things. And so I think it's absolutely critical as a student that you're exposed to this. My intent with this class is maybe I'm not going to make you into a CPA, but I hope to give you at least a broad overview of some of the most important components and issues related to finances in today's very complex world.